is it. Families with children are now receiving their final child tax credit when they file their federal taxes. And for many families, this could not come at a worse time. Good evening. I'm Jenny Ryan. Prices, as we know, are soaring at the grocery store, at the gas station, and beyond. And as 13 WHAM's Carla Rogner found out, that monthly credit was a lifeline for many families. Carla?
Yeah, that's right. When the child tax credit ended in December, it moved close to 4 million children into poverty. For one mother I spoke with, losing that money on top of inflation has been devastating. And it's the reason some politicians are looking to bring it back permanently.
This year and last year combined have probably been one of the hardest years I've lived through yet.
Leah Campbell is a single mom to her 3.5-year-old son. When the pandemic hit, the increased child tax credit was a saving grace.
I am by myself, so, I don't come across a lot of extra money that I can just use on anything, and my son's still a kid and he deserves to, go to the Strong Museum, go to the clubhouse.
Last year, the Biden administration raised the child tax credit from an annual $2,000 to $3,600 per year for kids 5 and under, and $3,000 for kids between 6 and 17.
Getting it monthly was just like a little bit of a relief, like, oh, well, I can use this now to go get my son's haircut or to pay my car insurance.
Then the credit went back to normal and inflation hit.
It's scary. You never know what's really going to happen next.
The pandemic created additional need for people who were already poor. So removing the tax credit is unconscionable as far as I'm concerned.
Jerome Underwood works with families at Action for a Better Community.
Children are poor because their parents are poor, their families are poor. So providing relief to families, which will ultimately trickle down to children, is what we should all be looking to do.
Some politicians, like Congressman Joe Morelli, have pushed to make the increased child tax credit permanent.
I was shocked that they ended it because, it's really about your kids and your children and providing for them and being able to make sure that they have everything 100%.
President Biden briefly brought up extending the child tax credit in his State of the Union address, but he hasn't had enough support in Washington to take action.
Attorney General Tish James is throwing her support behind healthcare workers in long-term care facilities.
It's time to lift the pause on both of those bills and put in place staffing ratios, put in place a law that was deemed to address where the profits of some of these owners should be placed, and that is back into the nursing homes.
The AG calling on the state legislature to guarantee wage increases for nursing home workers. Good afternoon, I'm Dan Schrack. Jenny will join us again at 6 o'clock. Through the pandemic, James says those employees worked day and night, did not have adequate PPE, and oftentimes were underpaid for hours worked. All concerns some families say directly impact the quality of care.
For nearly 2 years, staffing has been one of the greatest concerns inside nursing homes, directly impacting the quality of care. Advocacy groups accuse the state of dragging their feet, promising change, then backing down, keeping a billion-dollar industry happy.
Our big message is that nothing's changed. We are in the middle of reform, and it's 2 years later, and not much has changed.
In 2021, New York State approved legislation capping nursing home profits, directing 70% of revenue be spent on direct patient care, with 40% going towards staffing. But nearly a year after the measure was introduced, the reforms have yet to be implemented. An executive order signed by Governor Hochul has delayed the changes 3 times.
The past 1.5 years of dire nursing home reform has left our residents and family caregivers praising the movement of reform, but we're very concerned at the fact that on the front lines, not much has changed.
In early December, the staffing shortage reached crisis levels. Hospitals overwhelmed by COVID patients and long-term care facilities too understaffed to take in new residents, forcing the state to call in the National Guard. And in an audit released last week, the state comptroller found the Department of Health was unprepared to respond to infectious disease outbreaks in nursing homes even before the pandemic. The report also estimates COVID nursing home deaths were undercounted by as much as 50%.
This isn't new news for us in terms of another report coming out. We know that there were many vulnerable that were lost, that unfortunately history and our leaders don't want to put pen to paper and document it accurately, which is tragic.
Today's announcement by the AG follows a meeting with United Healthcare Workers East.
There is yet another push to end standard time, moving our clocks forward in the spring and back in the fall. As 13 WAM's Dalton Williams found out, sleep experts don't think it's a move in the right direction.
The sun could be setting on changing our clocks twice a year. Lawmakers are debating whether or not to eliminate standard time and remain solely on daylight time. Some parents say the time change greatly impacts their child's routine, and being on a more set time schedule would make more sense.
Most definitely. So it was very stressful when you lose an hour and then her schedule is completely off for at least 2 or 3 days. But yeah, that would definitely standardize everything and make it a little more easy as far as schedules go.
The University of Rochester Sleep Center says the switch to daylight time instead of standard time is a step in the wrong direction.
We're to stay on daylight time in the winter, especially in northern states. The sun won't come up until, like in some states, as late as 9 a.m. If the sun is rising late, most of us have to get up to start our day well before 8:30 or 9 o'clock. And our bodies just weren't meant to wake up when it's dark outside.
She says the time change impacts everyone differently, but this permanent change could end up causing more problems.
The sun is what kind of sets our circadian rhythms and gives our bodies cues to be alert and awake. So we won't be getting any of those cues if we're waking up when it's still dark out.
And for parents with school-age kids, they may have to change their routine at drop-off in the future.
Right now, I'm a stay-at-home dad, so this one doesn't go to school. But for my other one, he will be going to school, but we'll be dropping him off. So I'm not too concerned about that just yet. But for the future, I guess there will be a little concern, but I feel like parents should probably wait with their children at the bus stop anyway.
If, and it's a big if, the measure becomes law, it would not take effect until 2023. However, the House of Representatives is not making this bill a priority and says it won't be voted on anytime soon.